if you need to do more than 2 or 3 cuts. So for example, Selectis is doing usually 2 cuts in many of their products where they knock out TCR and CD52. It worked really well. But now if you want to go to more like 3, 4, let's say 5 loci, so you start having issues that first, when you're working with primary cells, like primary T cells or primary NK cells, you're going to have a mosaic of edits. Yeah. Right? Their efficiencies are not 100%, so you're going to have a low percentage of each, and you're going to create 50 different populations having a different collections of edits. And there won't be only edits, there's also some risk of translocations between different sites. When there are cuts, they're going to recombine together, which can, in some cases, add some toxicity and result in clonal expansions. There's been a clinical trial at UPenn where they did 3 knockouts at the TCR alpha, the TCR beta, and the PD-1 locus, and then they use the lentiviral vectors delivering a recombinant TCR targeting NY-ESO1. And what they saw is that first they saw there were a lot of translocations. They were detecting it, although none of these translocations resulted in a clonal expansion, so all of them were more toxic to the cells than transforming them into a leukemia. But it still showed that there is a lot of risk. And at the end, they had this mosaic. They had 16 different populations injected into the patients. And I think that was almost done on purpose to see, let's do all these mutations and see which one is going to proliferate the best, right? But clearly, when you want to multiplex, you need better tools to do that. And so I think the base editors right now, like you mentioned Beam, I think are good candidates for that. They showed, since it's not based on like double-stranded cut, it limits the chance of having a translocation. Yeah. And then they recently showed some multiplex editings where they had almost 0 translocations while still having disruptions of the gene of interest.